Great. So I've got pretty much everyone back now. Thank you for joining back. I had to restart, keeping in mind it was asking for a software update, so apologies for that. We're going to be looking at discussing learning outcome 4 today in the same unit. And previous to this, when we got disconnected, I was asking a question to everyone to kind of update if you managed to do the or undertake that questionnaire, which was to discover your learning style, which was Honey and Mumford's learning style questionnaire, in order to find out what kind of a learner are you? Are you a theorist, reflectist, pragmatist, activist, or somebody who looks at things from a practical angle? And I know a couple of you mentioned that you have done that, which is great. If you, as I mentioned to you earlier, if you've saved a screenshot of when the results came out after you did the multiple choice questionnaire, then the idea would be to save it and also email it to us, because that will give us insight into what kind of learning style suits you best. And at a later stage, what we will be able to do is obviously look at using that as a bit of a task, or basically we'll look at completing a particular task with that being done as a exercise. Right, so today we are going to be looking at starting learning outcome 4 for this unit, which is personal and professional development. We've covered in our journey so far, as I mentioned earlier, 3 learning outcomes. We started off with understanding, what could be the different kind of careers in health and social care. Again, here I had, if some of you recall, I had given across a particular link to the NHS website, which basically helps you discover by taking a 5-minute questionnaire survey to understand what could be the best suitable role for you. Again, I've got Farida, which is primarily send that over to me diligently. Thanks again for doing that. A screenshot of it in terms of what kind of roles are suitable depending on when you take that survey. It just gives you, it's a tool which essentially just gives you a bit of an insight into looking at taking your skills, your knowledge, your attitude, and your behavior, and your approach towards this particular sector. And then after completing the short survey, you're given certain recommendations, based on the information you're provided in terms of which roles are going to be suitable. We looked at in learning outcome 2, also discussing what are professional standards required in health and social care. And obviously, in this case, we looked at in detail, going into a bit of detail to try and understand why is it that personal and professional development has a big focus within this sector, in terms of ensuring that you're continuously gaining new skills, you are essentially updating your skills, which would be required for you to meet standards in terms of compliance from Professional Standards Agency or Authority, PSA, and the CQC if you're working within the sector or working in one of the roles within the health and social care sector. We looked at some of the major acts and compliance-related statutory acts, which are things that you need to be aware of, things like the Healthcare Act, things like the Health and Safety Act, the Care Standard Act, and obviously went into some of the other details of looking into some of the associated acts, which are depending on the area that you work in and the role that you have, you will need to be aware of them, and then some of them are put into practice when you're carrying out your day-to-day activities. We also looked at understanding what are national occupational standards, what are codes of practice, and related that to health and social care in particular in terms of the CQC compliance, and also understanding some of these national occupational standards which are put into place when skills analysis and audit is done, and then professional training and development is put into your career professional development, so that you are able to have the skills which are required to be able to deliver on jobs or responsibilities that you have in your day-to-day job. The third learning outcome was essentially looking at understanding what is reflective practice. So anything that we learn, and with a bit of hindsight, if you are given that opportunity and you want to go in and do things differently, learn from the mistakes, as we say, sometimes you want to adapt, change, or amend the way things have been done. This is the process of reflection. And when this is done primarily in the health and social care sector, in medicine, in pharmacy, teaching sector in particular, they are done primarily to ensure that best practices are adopted, and if there are changes required, amends required, which are so required to be done, can be done in the in carrying out some of these processes or implementation of policies, which would then help meet the standards set by CQC, the 14 standards which are required to be followed by care home providers, domiciliary care providers. We look at the principles of person-centered approach. We look at the Care Standards Act, and they tend to relate to when we look at reflective practice. So here we are looking at understanding the role of, say, for example, one of the examples I took in that was, if you recall, was the role of safeguarding. And when we look at the role of safeguarding, there are 3 particular acts which come into play, and they have to be put into practice. And that is where, when these are put into practice within any organization, it ensures that people, children, vulnerable adults, they're all safeguarded, and they are not subject to neglect or any sort of abuse when care or care is being provided. Now, we also understood the theoretical models, and that is where Klopp's learning cycle and Honey, and Mumford's models come in to understand why these models of reflective practice have become popular and why they've become industry standard right now. And that is where I asked you to do a bit of a test or a quiz to essentially get to know your style of learning. And it would be helpful if everyone does that, because that will be required for you to complete one of the tasks in the assignment that we will discuss later. We also looked at the role of attitude, beliefs, and values, and how they can influence or influence your let's say behavior at work, and how you look at maintaining professional conduct when you are at your place of work, when you're delivering on roles and responsibilities within your role. And they could be looking at understanding the Discrimination Act, the Equality and Disability Act, and ensuring that even if you come from different background, culture, you have different beliefs, they should not influence you when you are providing care or delivering care to patients in the sector. So a nurse, for example, or a healthcare worker should, that is why training comes in, that is why codes and codes of practice come in, that is why standards are implemented, so that people from different backgrounds, different diverse backgrounds can still work within the sector and provide the services required in terms of care, integrated care, and meet the standards to the same level as everyone, within the organization. So it's like singing from the same songbook. And then there were some of the bits that you have to look at, doing a reflection on your own learning and in your own area. That means you would need to do a bit of reflection in terms of, say, for example, how have you found the course? What are you learning from the course? What skills you expect to learn from the course or gain from the course when you complete this qualification? And how would they help you in, taking up a role within this particular field, like within the NHS or the, healthcare sector in general. Now, looking at the last learning outcome, this is the learning outcome wherein we're looking at, again, going into a bit deeper in terms of how do we plan personal and professional development. And there are a couple of, assessment criteria on this side that we want to look at. And these criteria typically would involve us to look at outlining the planning process for personal and professional development. How do we look at identifying our development needs? How do we set SMART targets? And then towards the end, we are looking at creating a personal development plan and then carrying out certain set of activities required by conducting a skills audit, which will help us make our personal development plan a bit fuller, so that we know what activities we need to improve on. It's not a generic plan. It is a specific plan which is going to help you gain some skills once you complete those activities, once you complete or undertake training. And that is what we will need to discuss. So I'll switch over to the presentation now. We're going to be looking at discussing this particular topic with a presentation which I've prepared. And this presentation would typically be looking at getting into details of learning outcome 4 indicative content, things like what are the stages of planning for personal and professional development. And then we look at how do we identify development needs, which is primarily done through a 4-pronged process, which is feedback when you work within the organizations from your manager, your supervisors, You look at reflection or reflective practice that you do towards the end of the year. You do a skills audit, and then you look at training and coaching, training and development, which could be done through mentoring or coaching, or attending training seminars or training and development events which the organization organizes. And this would help you identify not just your development needs, but also help you develop them over a point in time, so that you are able to perform to the best of your abilities in your role. We look at SMART targets, and we look at how do we look at creating a PDP towards the end. So a fair bit of content which some of you could have gone through in the academic and research skills unit. And as I mentioned before, this unit has been split from research in health and social care, and then a second unit which has been created with lesser number of credits, with 8 in particular instead of 15, and that is differentiated or separated the PPD aspect of it from the academic research skills. Now, before we go into the assessment criteria, the idea here would be to try and understand and differentiate between two key terminologies. One being personal development and the other being professional development, because the learning outcome focuses on talking on both the aspects of personal and professional development. So if I look at the meaning of personal development, basically personal development here talks about you focusing on ways and activities or things or tasks that you do which are going to be based on self-improvement. They are going to be leading you to look at raising your awareness, which is basically self-awareness, your own capabilities, your own potential, maybe building your own knowledge. And they would be looking at enhancing, the way you work or approach work in a particular workplace. So personal development tends to be, activities which are designed to improve talent, which is on an individual level, your potential employability options, again, at the individual level. And to a certain extent, these activities could even be looking at, you accumulating, say, when I say knowledge could be in the form of academic course or a degree, and that would put you in a good stead to become more employable. And in some cases, these activities that you undertake are going to look at overall improvement in your personality as an individual, and they would be related to what is called personal, development. Now, when we talk about the word professional development, now professional development usually refers to when when your activities are being tracked and they are being documented and they are being measured to ensure that you are performing to your utmost potential. They would be termed as activities which an employer would take for its workforce, and they would be termed or deemed as for professional development. So in this case, you're looking at making improvements in your skills, in your knowledge, in your way of working. You're advancing in your career maybe, and that would be done through the employer. And this would take the route of you attending training, development, maybe looking at undertaking some sort of, small projects which you are put on to primarily see that if there are areas or qualities or, essentially skills that are deficient, then the employer will identify those deficiencies and then put appropriate training in place so that you are able to perform to the best of your abilities in that role. And this bit can also be academic, and it can be vocational. Academic tends to be in the UK. If you look at, and if you look at vocational, first give you an example of vocational here, would be a lot of people look at, training through apprenticeships. They look at doing a course through apprenticeships is because they want to do on-job training. So they are basically going to be employed. They're going to be working within that sector. And then they are also parallelly studying or, looking at gaining skills which are going to be of academic nature apart from working within that field. So when you look at a plumber, when you look at an electrician, when you look at a nurse, when you look at a healthcare worker, you would see that in these courses at higher levels, at the degree level, or, you would generally be required to be put on a placement for a number of hours. And that bit of work that you do in terms of placement in certain organizations to get practical knowledge is going to be related to vocational nature of the course. But at the end of it, you're also enrolled in a 3-year nursing degree or a 4-year nursing degree, and then or a 3-year bachelor's in health and social care. And when you complete that degree, you also get an academic qualification, and that would allow you to professionally develop your career. And that would mean or relate to what is called professional development. So professional development in general will be competencies that you develop at your place of work. It could be managed by the employer. It could also be managed by yourself personally, but generally managed by the employer. And they would take the form of training and development, learning and development in different shape or forms, which could be both academic and vocational in nature. They will help you gain skills which are going to be helpful for the employer when you're working in that role and being able to deliver on that role and responsibility more efficiently and more effectively, thereby leading to increase in productivity, which the employers or the employers or essentially organizations would want from their workforce. Now, personal tends to be, which is something related to your own self and you are managing it. And this would generally tend to be related to your, skills, your attitude, your behavior, your personality. They could be also looking at helping you, become employable, become more, favorable to employment. And in those cases, you're looking at, gaining skills which are going to help improve your talent and your potential to become employable in the job market. So sometimes we look at, a simple example of personal development here would be sometimes when you're looking at going for a job interview, you sometimes end up taking some coaching in terms of how to appear for an interview, how to dress up, and how to attend a professional interview because you want to crack that job or you want to finally get that job. So in this case, this is more of personal development because you're looking at improving your own capabilities or self awareness, leading to the development of capabilities that are going to be useful for you to highlight when you're appearing for a job interview. Professional development, an example on the other side would be when you're looking at, say, for example, doing a training, and this training would be, say, for example, a training in the field of nursing, in the field of health and social care. And this training could be an apprenticeship or an academic degree that you're undertaking. And this would be looking at helping you advance your career. And this would make you more employable, but it will also help differentiate the qualification that you have from some other people or other professionals who are applying for the same role. And that would be termed as, typically professional development. Any questions on this so far? Has the difference been established? Have you understood what is personal development and what is professional development? Any questions on this so far? Happy to take now. Okay, so let's look at going with this particular background into some of the assessment criteria that we need to also discuss. Now, the first one talks about outlining the stages in planning your own personal and professional development. Now, there is a particular model that we look at when we are looking at doing planning for development. And this particular planning model that we look at is called the SOARS, SOARS. This SOARS model primarily, is a model which looks at helping you define, personal development. Now, SOARS actually stands for, S stands for selecting an area for development. Now, obviously, there are lots of things that you would want to develop, you want to improve, you want to look at, improving from a point of view of making yourself more employable, maybe going up in your career, maybe getting a better job, getting a better salary. It could be even for personal reasons that you would want to accumulate, say, for example, more wealth or become, let's say, more comfortable in the job that you're doing. So here the idea is to try and shortlist and filter it down to an area which is going to be measurable, the area which is going to be finite, and it is not a generic objective that you are putting, for the purposes of starting your planning. So select an area of development, a particular area if possible, and that then leads to what is the next objective, which is O, and O stands for objective. So here you're looking at, putting down why is that you're looking at developing that particular area. So for example, if I am a nurse, or if I'm planning to become and take up a nursing career. So in this case, my specific area of development is to gain knowledge, which is academic knowledge, so that I can become a registered or a qualified nurse. And in this case, my area of development will be academic first, because I need to have a nursing degree or a nursing diploma to be able to work within the sector. So it is a very specific area that you want to get into, or maybe a healthcare career, or maybe an area manager, or for example, a sales manager. So you want to become a marketing manager. So you're looking at a very specific area for development. That means you're looking at maybe shortlisting a course or a training, or maybe an activity that you would undertake, which will help you at the end of the day, improve your skills and your knowledge and information in that particular field. Then when you look at setting the objectives, you're looking at setting the objectives within that. So when you look at, when you say that I want to look at developing a career in nursing, then what are the objectives? Why you want to become a nurse? You write those objectives down, and then you prioritize them, that these are bits that I would need to start up with and complete first, and you arrange them in some sort of a chronological order. Then we go into something called actions. Now, what are the actions that you need to take? Now, saying that, say, for example, I want to become a nurse is fine, but having that goal is also fine. It is good. It is a noble thought. But you would need to make or take initiatives to be able to get into that particular, role. So here you would need to make an application to a university or a college to study nursing, and that would mean that is a particular action that you will carry out, because at some stage you're looking at ensuring that these activities that you are undertaking are going to lead to some sort of an end result. Now, last but not the least, it talks about sustaining. That means you're able to sustain the development and then review it. That means you are going to join a 3-year university course for healthcare management or for nursing, and then you will going to be able to complete that course. You're going to make sure that you put enough efforts and you're motivated enough, you're working hard enough to be able to complete and achieve the course. That means you go past the first year, you go into the second year, you go into the third year, and then sustaining this bit of knowledge building and studying the course would help you complete the course and achieve the degree. And that is what you would be looking at when we do in terms, or when we talk about in terms of stages for planning. So sometimes we look at this particular model, which is called the SOARS model. And this particular model would be an acronym for select areas of development, look at objectives, which are going to be put as SMART objectives. We'll come to that in the later part of our discussion. What is SMART? We'll look at what are the actions. That means what are the activities, what are the steps that you will take in order to meet those objectives, in order to ensure that these objectives are fulfilled. You're going to record your progress, basically making sure recording your progress would be, if you pass the first year of your nursing degree or your healthcare management degree, you get a transcript from the university or the college, and that would say you achieved this, you completed these many modules, and that is a record in a way of your activity. If I pertain it to this example that we've taken of you putting or selecting an area for development, which is doing a nursing or a healthcare degree, and then towards the end, you're sustaining that development, which is to say you've gone successfully and completed the first year. Now you want to go into the second year, then go into the third year, and then complete and achieve the degree, and then become employable in the market. Now, when we talk about a personal development plan or a professional development plan, in short, we can name this as PDP. If it is being maintained, reviewed, and updated and shared with the employer, this becomes a professional development plan. If it is being done at the personal level, wherein you make it, you review it, you add activities to it, then it will be termed as what is called a personal development plan. Now, there is a template that I'm going to share, and obviously there are some steps that you go about. As I mentioned, the model, which is the SOARS model, you can simplify that into certain steps of how you would prepare a PDP for personal development or a development plan for professional reasons. So when we look at personal development plan, you set your goals, you prioritize these goals, and these are the steps that we take to create that plan. And then when we look at a professional plan, there are certain steps that you will take. Some will be taken by your employer. There are some additions which have happened to this in terms of planning, is because in this case, you are not just going to be responsible for your own development, but it is the onus is also going to be jointly resting on the shoulders of your employer, your manager, your supervisor, or the department head that you're working with within the organization. They will assess your performance. They will be looking at assessing your suitability for a particular role, how you're performing, how you're delivering, and then they will be looking at deciding on specific career goals, which are going to be discussed with you during your annual appraisal, and they will allow you to then put this particular documentary or commentary will be documented, and this commentary, when it is documented into a plan or at least a number of activities which are going to be taken place or put into place for you to develop those skills, would be termed as a professional development plan. And the reason why this is, towards the end of it, you look at whether it's a personal plan or a professional plan, you always review the plan at some stage. There is a timeline that you set, and at each individual timelines, you basically set a review date to ensure and see whether those activities have been completed, whether those goals have been met, and if they have not been met, why they have not been met, and what could be additional activities or things or support that you need to be able to complete them. They would be a part and parcel of when we are looking at planning side of things, when we talk about development, whether it's personal or professional. Now, there is an example of a PDP which I have put in place for us to see, and this particular example talks about a generic one. I've taken this on purpose is because for us to be able to understand and put a plan in place, we need to be able to relate to something which is easy enough to follow. So I've taken a simple plan of, I want to become, say, for example, an area manager. That means I want to be able to go from my current role of being, say, a sales or a marketing executive to being an area manager, which is going to manage a number of employees and a territory for the purposes of, maybe a product or looking after sales of a particular product for a company. So when we look at a PDP, and if this is something which is clearly visible, if I make this full screen, what you're going to see is that the PDP is essentially a number of rows and a number of columns. Now, what are your long-term goals? As I would say, when we look at the personal and professional development planning, we use sometimes the SOARS model. So specific area of development is that you're looking at a promotion to becoming an area manager. That is your specific objective. Now, within that specific objective, we are looking at specific, goals, or what are the actions that you need to take to meet those objectives for development in that area. So here, it could be that you are dividing them into 3 different parts, which are measurable also, attainable also. So first, you will not directly go from being a sales executive to a manager. In between, there'll be some transitions, of job roles that you will need to go through. And they will be that you at some stage, because you're achieving your own targets or you're meeting your own, targets which have been given to you by your manager, you are now looking at becoming a supervisor first. That means you're able to manage things yourself first. And then what you want to do is get into a position wherein you want to try and manage it for some of the other staff or employees within the organization. And that would mean that you're looking at stepping into the role of being a manager. Now, after that, there will be a certain set of activities and goals that you will put in. So here, because you are now not working alone and you're working with other people, your leadership skills, your communication skills, your networking skills will need to be improved. And that is why the goals have been put by that person to say, okay, I need to improve my interpersonal communication skills, or I need to improve my communication skills and leadership skills. Now, why do you need these skills for work? That is the specific SMART target that you're putting in. So when we look at SOARS, you're looking at the actions that you need to take to be able to put this objective into place. Is you're looking at specifically developing leadership skills, because you want to be able to lead, you want to be able to manage when you become a supervisor. And then what are the activities you're going to undertake in terms of, that will allow you to build these skills or the competencies. You're looking at taking an online leadership course. You're looking at joining the company leadership course, which is a training which is organized by the employer. And that would be the activities or the set of activities that you'll undertake. Now, how long will you take and when will these activities be completed? There's a timeline that you put, and that is 6 months. Now, once you've completed this, then at some stage you've done the basic minimum requirement of having the academic qualifications to become a manager. The company would then make you a manager. And when you become a manager or a team manager, you are looking at developing further skills, and that has a particular timeline. And then when you transition from being a team manager to an area manager, there are some of the other skills that you will need to gain, and there is a particular timeline for it. So when career planning is done within the organization, or growth planning is done, or your professional development planning is done within the organization, it tends to be long term. So you might discuss with your manager or your supervisor to say, I want to become an area manager in 2 or 3 years' time. And that is what the company would do, sit with you, put a plan in place. And this plan will be the professional development plan, which will have a timeline, certain set of individual activities and tasks and actions to complete. And once completed, this will help you move, transition from the role of being a sales executive to a sales or a team supervisor, a team manager, and then an area manager. So looking at this particular template, what I would suggest is there's a blank version that I've put in, and this is available as a PDF and a Word document. This is where you would need to look at filling this up to develop what is called a professional or a personal development plan. The reason I say professional here is because we are looking at developing our skills and our knowledge, and doing this course essentially to get into becoming employable within the health and social care sector. So this will be a professional development plan that you need to put in place. You might put a long-term goal here that I want to look at becoming a nurse, and then put the activities in place. Or let's say if I want to become a qualified healthcare professional, HCP, then you put these in place by doing a bit of research and seeing what are the activities and how I would transition from doing this particular course to becoming a healthcare professional in 2 or 3 years' time. And that would help you understand the steps that are required for planning personal / professional development. Is that okay? Any questions on this so far? Is that understood? Any questions, anybody? Any questions at this stage? Has this been understood? Okay, so let's go to the second assessment criteria, which basically talks about, how do you identify your development needs? So we should know that we should be able to understand, how do we discover that these are my learning needs? This is what I need to learn. This is what I need to develop on. So there is a way that we are able to pick up on our gaps or our areas of weaknesses. And this allows us to then understand that this is my weakness related to this particular role that I can't, and because of the weakness, that means lack of knowledge or lack of formal education or, certification in that area does not allow me to take up that role, is what we need to look at when we talk about identifying needs for development. So in this case, some part of this, when we look at now differentiating between personal and professional needs are going to be, discussed by the employer, because they would be looking at assessing your capability, your competency, and towards the year end, when you have your appraisals, you have your feedback, they will be informing you about the areas in which you need to develop further to be able to either continue in that role, perform better in that role, or maybe get promoted in your role. Now, this sort of analysis, which is done for an individual at the organizational level, is going to be, looking at working with the HR, looking at working with the department head, and then looking at working with the individual, which is undergoing this process of, review to identify development needs, is done at the organizational level. And they would be looking at performance metrics, your existing strengths and weaknesses, your existing academic knowledge, your experience in that particular sector. And then they would look at, matching them with the aims and objectives of the organization and see where are the gap areas, where you need to, develop. And this would come in by 3 different, ways. So one would be the feedback from your manager or your supervisor or your department head. The second would be you would do a reflection on the things that you've done well over the year, the things that did not go as planned or did not go as well as you had planned, and things which went wrong. And that would be the process of reflective practice. And the third will be, there would be sometimes we make use of questionnaires, software, or skill audit surveys that will allow us to discover our weaknesses and areas in which we need to develop further. And they would tend to be done primarily through some sort of an audit. And this audit could be done personally. That means you could do this on personal attributes and skills, and you could also do this audit on professional attributes and skills which are required for you to perform the job well. So they might have some sort of a ranking system, they might have some sort of a system in which you take feedback from peers, colleagues, and see how do they rank you on this particular aspect. And they would be looking at the process of what is called the skills audit. So we will discuss this in detail. So what we need to do is we need to go through some of these steps to understand that how this process of skills audit is done. And I've got a template that I will share with you, which is what some of you have completed earlier for the other unit, and that same template can be improvised and used here to look at doing your skills audit both at the personal and professional level. So what we need to do is look at this one by one. So let's look at the first aspect in terms of feedback. So when we look at the feedback, what we want to be able to understand from our managers is that when we see work being done and work being done from a particular aspect, if I look at discussing this in a more specific, example, with a specific example, what I mean by that is, for example, if you are new to your place of work, you've joined a particular organization in health and social care, and you have been put through a bit of training. You've gone through some of the essential trainings like health and safety, data equality, how equality policy, data protection, looking at the Computer Misuse Act, and you're aware of certain basic compliance and acts, legislations that you need to be aware of in order to carry out your day-to-day responsibilities. Now, over a point in time, your role also diversifies into dealing with clients or patients, and your role also diversifies or requires you to work and use certain equipment. Now, if I say you need to look at, when you look at, essentially making those improvements, you are going to be also essentially getting this feedback from your manager to say that this would require you to, get into training. Maybe the employer would put some of them in place, which is things like if there's a new equipment that you're working with or you're required to work with, say like an MRI scanner or an X-ray machine, or, some sort of a, machine in the health and social care sector, like a stethoscope, maybe a blood pressure monitor, when you do the blood testing, things like that, they would require a bit of training. So here, the manager would say, okay, you're new to this, and you've taken up this particular role, but this requires this training, and this is where the feedback would come in to say that you wouldn't be put into this particular training, and that would help you understand how to operate this machine on a long-term basis. Now, secondly, the feedback would also be coming to you when you look into getting into meetings, group meetings, team meetings, department meetings, and that feedback would be generally on the role that you're playing in the overall delivery of the roles and responsibility of the organization. And in general, that feedback would also relate to the manager giving you specific feedback with the aspect of what you have participated and contributed in that particular role. And that would aid in the development of helping you to understand that this is the bit which I've done correct, this is the bit which I've not done correct, and for which I need to look at getting more training. And they would then be maintained as training records within the organization. The second way would be when you look at taking feedback informally, when you do team meetings or when you work with other colleagues within the department, your co-workers, you are going to be looking at both the process of informal and formal feedback. Formal feedback might come in during activities like, performance appraisal, quarterly reviews, but informal feedback could be given during meetings that you attend, the could be team meetings, it could be department meetings, it could be meetings or general get together that you have with other colleagues, and sometimes you also seek informal feedback, and they would help you understand what are the areas in which you need to develop further in terms of capabilities and competencies. We've discussed reflective practice in detail yesterday, and the reason of looking at reflection would be to look at making your own notes and making sure that you are essentially revisiting some of these things to find out what are the areas in which and how you would differentiate doing some of these things going forward, because with the information and knowledge that you have now, because of maybe feedback and training given by the employer, this allows you to now do things in a much more professional, productive, efficient manner. And when I say they, I mean the organization has provided you enough guidance and training to be able to carry out that task successfully, repeatedly, and that would be the case when you look at reflective practice. You look at training and research. Training and research would be your employer conducts a lot of training throughout the year. A lot of companies have employee training portals now, and a lot of employees are expected to complete 2 or 3 short trainings in a year to develop their skills and competencies, and these are present in certain organizations, specifically so within the NHS. And any new, say, for example, process, policy, equipment, task, or any procedures introduced, all staff are required to do mandatory training on them using the employment during the employer training portal within such organizations. So NHS has one, and NHS has a learning and training development wing or a department which allows nurses, doctors, professionals working within the National Health Service to do continuous training. And that is put in place to ensure that for some of these trainings that you do, which are at the professional level, you're also given an attendance certificate. In some cases, it is a certificate because it's a qualification or a test that you've taken and you've achieved that skill, and you get a certificate at the end of it. Things like small certifications on how to use effective PPE, how to deal with patients with dementia. There could be trainings on care certificate, things like that. These are small trainings, half a day, 1 day long training, health and safety training, hygiene training, for example. And these trainings, generally tend to be half a day to a day long. And when you achieve these trainings, at the end of the training, you have a test. You complete and achieve that test, you also get a certification for it. And they are a part and parcel of how you will also get feedback to improve your capability and competencies within the organization. Last but not the least, we're looking at skills audit. You do your own audit of your capabilities. And this audit of capabilities is primarily done maybe through a particular template or looking at your competencies and skills, both on the personal and professional side. You could also do a SWOT analysis, which could be your strengths and weaknesses analysis, and you could identify your areas of weaknesses, and they would then be put into certain activities for development, because that, say, for example, you have a weakness in terms of, say, time management. This could be a personal related attribute. But if I say you're looking at communication, improvement of written communication skills, this could be professional attribute, because in your place of work as a nurse or as a doctor, if you're required to give prescriptions which have to have accurate description of what medication is prescribed or treatment is to be done, then in those cases, sometimes you would need to look at maybe taking a training on communication, written communication skills, and that would be something that you will find out by conducting a skills audit. And there is an audit template that I put in place on Moodle. Some of you would have seen this template earlier. This template basically is a combination of some personal and professional skills which I put in, and this can be completed in order to do your skills audit to find out whether you have very good knowledge, very good capability in a particular area, or you need improvement, or you are not aware that this is a skill or a capability and you need to develop this. In order to do this, you will have to undertake some activities. So you will rate yourself in things like, I can do this well, I can do this okay, but I need a bit more practice, and I can't do this at all. Now, you'll also rate these skills because some of them might be directly related to your work, some of them might be indirectly related to your place of work, and so some of these might not be required or at all important for you, because you don't do or carry out these things on a day in, day out basis in your job responsibility. So basically taking them here by using an option to read it. I have strategies to help me plan and manage time. And if you feel that you can do this well, just do a tick. Now here, if you are in the front desk within a surgery or in a hospital or in a A&E department and you're dealing with a number of patients, this is a very important skill because you are going to be dealing with an influx of patients, ambulances, staffs which are going to come in, and you need to be able to manage your time, ask very specific questions, and ensure that you're able to direct them to the right place or the right department or right people. And that is why this skill is going to be very important. So here I would rank it as 1 because it is something very important. If I look at the second one, I'm able to effectively prioritize my tasks and activities. You've got lots of them to do on a daily basis. So here the idea would be you should be able to understand what is urgent, what is important, what is urgent and important, and what is urgent and not important. So if you're having that understanding, then you can say, I can do this well. And if this is something that you use every day, when we make a to-do list, for example, in our place of work and say, okay, these are the bits I need to finish today, then in those cases, you are going to rank that, okay, this is something which is quite important for me. And in areas that you will mark that I can't do this, say, for example, some of the areas, these areas, I can't do things or I can't do them at all, then they will be put into what is called areas of development. And we will look at this, in the next section. So this particular skills audit template consists of areas of organization of learning, information seeking skills. Somebody who's at the reception in the hospital in a surgery should be able to ask the right questions, the right amount of questions to get the correct information from the patient. So you've come into the surgery. Do you have an appointment? No. Okay, if you haven't had an appointment, then the walk-in surgery times are over. You'll have to either come in tomorrow, but let me check the diary to see if there is any appointment free. So the questions from the receptionist or the nurse at the reception or the person at the reception are very specific to the patient because they would want to get the right amount of information, the correct amount of information, and then quickly give them a solution. Now, all the appointments are full. Sorry, you'll have to either look at a walk-in surgery tomorrow or call us between 8 to 8:30 to be able to book an appointment with the GP. And then the nurse will also, the person at the reception will also take and ask questions about what is the problem, what is it that you want to see the doctor for, and then they will confirm the name, the date of birth, and the record to say, okay, the patient is registered with the surgery, things like that. And that would be an example of information seeking skills. Then you look at reading and note taking. You look at writing skills, spoken communication. You look at information technology, use of IT, working with numbers in some cases. For example, if you're a nurse and you have to take blood pressure or you have to look at doing a lot of tests which relates to numbers at the end of the day from equipment that you're using, then you need to have good numeracy skills. Then in some cases, if you're looking at your own skills like revision, looking at personal development planning, they could be informing you the areas of how you would identify what are your personal development needs. And this is the 3 ways through which we essentially undertake this task, which is identifying own development needs through taking feedback from your manager, supervisor, department head, to looking at the process of self-reflection or reflective practice, and then finally looking at doing a skills audit. And they would help you understand and identify what are the areas in which you need to look at, improving your developmental needs by putting some activities that you will complete, and they would then help you make those improvements. Any questions on this so far? Any questions? Okay, let's look at the third assessment criteria, which talks about explain how we write SMART targets. Now, SMART is an acronym which basically stands for specific, measurable, achievable, realistic, and time bound. Now, this is a template which is normally taken into account when we are trying to, plan our developmental needs. So one of the things that we talked about, in terms of the SOARS acronym was looking at the option of how we would be looking at setting specific targets, in the area of development, And when we look at, these specific targets, one of the things that we looked at in particular, if I just refresh this, for everyone, was basically looking at, specific objectives being set. So if I take this across to that particular slide, just to relate it here. So if we recall this particular image and the acronym source, you would see that there are, when you have selected your area of development, there are specific objectives that you need to achieve to be able to say that I've completed that particular, I'm working towards achieving that objective. And in this case, this SMART terminology comes in, wherein you list down specific activities that you want to do. You want to look at those activities having some sort of measurement. That means you can, at the end of the day, when you complete that activity, that you can see that it helps me achieve the objective, the overall objective which has been set. They are going to be achievable. You're going to put meaningful targets to achieve those activities. That means you're going to spend time, effort, in some cases money if you're doing a course, to be able to achieve those objectives. And are these targets that you've set achievable? Are they something that even after doing some of these activities, will you still be able to achieve those targets or achieve that skill or not? An example here would be, say, for example, if I say I want to learn Spanish, or some of you say if I want to learn French or German or any other language, for example. Now, in order to learn a language, you have to be very specific. What do you want to do? You want to learn beginners, you want to learn it at a beginner's level, at an intermediate level, or at an advanced level. Then you look at what are the activities you need to look at undertaking in order to develop that skill to a beginner's level. Say, for example, every year you go to Spain or Portugal or some of the other areas which are Spanish-speaking countries, and you want to be able to speak beginner's Spanish or entry-level Spanish, so that you are able to converse with people in the restaurant, in public places, ask a few set of basic questions and get along, because the national language in that country is Spanish. And when you go, you want to make your experience a bit more enjoyable as a tourist or as a person who visits that country frequently. So in this case, you would put some tasks and objectives in place to say, how do I go about learning Spanish? You might want to say, I want to learn beginner Spanish. You might download a software on your phone to start to learn Spanish. You might go across and take a bit of coaching, classes for a couple of weeks, or, a short course to be able to develop that skill of learning the language. You might watch movies at the end of the day with Spanish subtitles switched on, so that you're able to develop the vocabulary required to be able to speak the language. Now, all these are set of activities that you're doing, and these activities are achievable. You can take a coaching for 4 weeks, 8 weeks, 12 weeks, 16 weeks, 1 year, in order to look at what is the objective of learning the language at what level, beginners, intermediate, or advanced. Now, if you want to learn advanced, sometimes you might have to learn something for up to about 2 years. You might also be recommended to take trips down to a particular place a couple of times, interact with people, watch movies, read books, and they will all constitute towards the activities that you're doing in order to achieve the advanced level of, speaking or writing that you want to do in terms of knowing that language. Now, again, when I say beginners, you want to learn Spanish or German or French, whatever, to a beginner's level, you might just be only looking at speaking part of it. You're not looking at writing part of it. So if you're looking at speaking, reading and writing and listening all together, then, different components, in some cases, that would mean you'll have to put specific activities down which are to be achieved in order to say that you have completed those activities, and they would then help you achieve that particular goal. So I want to be able to speak as well as write. That means some of the activities that you're going to list down are going to be achievable from a point of view of completing them, but they are going to be written activities to help improve your vocabulary or get to understand the vocabulary of Spanish words and, the way things, are in that particular language. And this is using this particular template because you want to quantify, break them down, review it, able to monitor it, and then achieve it. And they tend to be the goals and objectives that we normally set, and they are set using what is called the SMART template, so that it is specific, they are measurable, they are achievable, they are realistic, and they are time bound. Is that okay? Is that understood? Okay, you can, if you have any questions, you can ask me through the chat route as well, or raise your hand. That is absolutely fine. and I'll move on to the next task. So what I've done is there's a smart template on Moodle, which is a Word document that you can download. And obviously at some stage when we do the discussion on the assignment task, this is one of the tasks that you will need to go ahead and complete. And this would allow you to understand how to set targets which are following what is called the SMART acronym or the SMART template. Now, I have taken up an example here of Harvard referencing. A lot of us have not done assignments for years or have got back into education as an adult learner. Sometimes referencing your work tends to be a bit difficult. So a simple task that I've assigned, for myself would be to learn what is Harvard referencing system. And I've quantified that using a SMART target template. I've also put in an example here for those of you who want to understand how to put and use some of the practical bits that we do on a daily basis related to our job role into a SMART template. And they would tend to be looking at, say, things like stress management, increasing patience, time management, and team working, which tend to be a part and parcel of jobs in most of the jobs within the health and social care sector. And then how you go about, quantifying these as targets, areas which are for specific development, short-term, long-term, from a career perspective, and then look at how do you put some activities in place to be able to say that I will achieve these targets by undertaking these activities or completing these activities. And then you also put a timeline or a time frame to say this is where I would start and this is where I would like to complete. And when I have completed these activities that I've undertaken, they would help me achieve that particular skill or help me master that particular skill. And that would be using what is called the SMART target, because you're putting down something which is specific, measurable, achievable, realistic, and time-bound. If I say I want to walk from here to Dubai, it's a target, which is fine. I can put that in, but is it realistic? And I say, if I want to walk from Manchester to Dubai in about 30 days, that won't be realistic, because, if I walk a mile at a speed of 16 minutes, how long will it take for me to complete this task and reach Dubai by walking? This target is unrealistic if I put 30 days down, because I know at the speed which I walk, there could be adverse weather conditions, border controls, things like that, which will be required. That would mean that I won't be able to complete this task in 30 days. So when I put something down, it is unrealistic. So the idea of putting activities down, which are going to be specific, and those are activities that you can achieve in a set specific time, you have to put targets which are going to be real activities, which are going to be realistic for you to be able to complete within a particular time. Now, last but not the least, let's look at the last assessment criteria, which talks about creating an own personal development plan for the chosen career role. Now, for those of you who did this exercise by taking the NHS survey in Learning Outcome 2, when I mentioned, or Learning Outcome 1, when I mentioned, and have a screenshot of suggested roles, you might be able to take one of that role from that survey result which came out. And I know Farida and some of the others did it, and I've got that in the email. Thanks for sending that. You could choose any of that particular role and then develop activities around to say, if I want to become, say, an occupational therapist, or if it was a role which said you want to become a nurse, then you would need to develop a plan to say that, okay, how do I start? Where do I start? When do I start? And when do I complete those activities? What activities I undertake? And those activities, when completed, would allow me to become a successful nurse. So this bit that you have to look at is a plan that you have to create. There is a specific template that I have, which I put up on Moodle, and it's something that you need to do by looking into what I've discussed with you today. And then with a specific role in mind from Learning Outcome 1 that you've got, you could put that as a bit of a screenshot and then develop a plan using the template shown to be able to, achieve that particular objective or that particular role that you want to, take over, say, join or start in your career. Now, there are steps that you could look at taking in terms of developing this plan. It could be things which are quantified, as you can see on this side. I have put things like a summary statement, long-term, short-term, current skill, developing skill, and resources. This is what I've given you an example here of. We've taken short-term, long-term, with what are your current skills, why you're looking at developing these skills, and then what are the actions that you would take within a particular timeline to be able to complete those. have been mentioned here. Now, when I look at this from a point of view of career development, there are the same steps that I need to take, but what I need to do is again quantify them to a particular role that I want to look at developing for my career, my skills, my knowledge, my academic competence, and they would then follow, these simple steps. Now, when I look at the areas of development within the health and social case, health and social careers, they are primarily looking at, when I say you need to develop a plan in a particular chosen career in your for a particular chosen role, career role. Here you would be looking at focusing on 4 attributes. One is knowledge. What are the skills and knowledge that you need? What are the behaviors you need to show? And then how we would look at doing self-assessment or self-reflective practice. So if I was to become a nurse, or if I was to become a healthcare professional, if I was to become a pharmacist or an occupational therapist, what is the knowledge that I need to have? So for example, knowledge in this case is going to be related to a degree or a diploma or a qualification that you would get and enroll for, study, and then successfully pass it and achieve it. And that would be giving you the knowledge that you need to be able to work within that job role or in that career role. Now, skills could be skills that you have gained by studying that qualification. Skills could be skills that you have achieved because you've worked within that sector, at a particular stage in a particular role. And they would essentially be also skills which you have derived from by studying that course or that degree course. Then you look at behaviors. You need to be able to look at, what is the awareness that you have about that particular role, job, say, opportunities in a particular area, how you demonstrate that, after getting the degree, that you have the relevant knowledge, the skills and the attributes to be able to work within that role. Are you suitably employable? Do you have suitability for employability? That means, are you suitable for that role? Sometimes we look at doing an audit or a check in terms of finding out whether am I suitable for this role. So for example, if I want to say I want to become a fighter pilot and in the Royal Air Force, British Air Force. So there are certain specific requisites for this particular job. So you would need to have a specific height, maybe a specific weight. You would need to complete certain training. You would also need to have maybe an academic qualification. And after that, you'll be put through a particular test. And if you pass that test, pass the interview, you would primarily be put into the pilot training course. Now, do I show the behaviors? Do I have the appropriate degree or the qualification to make this particular cut? That is what will be quantifiable in behaviors. That means, am I able to meet the basic requirements set out for that role? And then you do a self-practice and assessment before you apply. You don't want to be feeling dejected or refused just because you wanted to apply and you have not checked out the pre-entry criteria or the eligibility requirements. And that is where this particular bit of self-reflection or a self-assessment comes in. So you look at your own attributes, you look at your skills, you look at the qualification, you look at number of years of experience, or are they looking at people who are novices in this area to be put onto the pilot training program. And when you self-assess yourself, you'll find out not this is not something I'm not ticking any of the boxes, or I'm ticking very few boxes. That would mean that I am not going to be accepted into this role because of 1, 2, 3, 4 reasons. So you do your own self-assessment to find out. And they are going to be a part and parcel when you look at developing your own plan towards a career, specific career role. So here the idea would be to look at, following a template in order to develop something for yourself. And that template is upon Moodle. That template is something which I've shown you here. And that is what you need to look at following to develop a plan. When I say a plan for a specific career that you want to pursue within the health and social care sector. Now, very briefly looking at just the last criteria, which is the merit criteria. If you have any questions, feel free to ask me. So the last specific criteria talks about, carry out a skills audit to identify development needs. So this is where the skills audit template would essentially come in, which I put in the slides earlier. So this particular template that I've shown you, the skills audit template, is the audit template that you would need to complete, which is up on Moodle in order to, essentially complete the merit task. And this is directly related to you completing this particular template, and that would allow you to, achieve this merit criteria for, carrying out the audit to identify your development needs. Now, the template, the reason I've not put this template, here, and I would show it to you, is because it's a Word document. And what I want you to be able to do is, rather than look at, PDF or anything else, there is this bit which I've enclosed here, which is a skills audit template specifically for health and social care workers, because you're within that particular, sector. So we don't want to do a generic skills audit, and that's why I didn't put the slides. But what I want to do is switch over and show you this particular template that you would need to do as an audit, for the purposes of identifying your own needs. Now, I have specifically looked at this template from a point of view of somebody who's going to be working within the sector as a social worker for children of young people. And it gives you a bit of a background, on the template in terms of what the template is all about and why it will be, asking you to do your audit of your skills by ranking or by selecting and reading some of the questions. So it's a 4-page template. First part of it looks at conducting your audit on, things which are required at the place of work, things like communication skills that you are basically on skills which are more personal to you. Then it looks at, you understanding processes within the organization. And then the second part is a knowledge audit, which is primarily looking at whether you're aware of the standards, the policies, the statutory compliances, which the organization and the role would require to be met in order for you to look at taking up that role, and they have been, mentioned on this particular page. So it's an audit wherein you are going to be looking at ranking yourself, whether you are aware, you have an understanding, or you have an expertise, or you are an expert in that particular area. And then if you feel that this is something that you need to improve, you would put what is called a date that you want to address this by, and then what date you would complete it, and that would be looking at essentially the skills audit that you need to carry out on your own developmental needs. And when I say your own developmental needs in a specific role, that specific role is a senior social worker role, primarily, who is working with children and young people. And that is where the skills and knowledge audit would be useful. Now, some of these templates that you would see on Moodle would be named accordingly. So this is 4M1. There's another template that I have, which I would say that you would use, which is for skills audit. And that particular template is on the PowerPoint slide I've shown you, but I'll show you here. It is going to be numbered as 4.2. That means this is something that you would need to complete for task 4.2. And then when we look at the professional development template, which is, the first task, in learning outcome 4, that would be this particular template that you will be able to go in and see. First is the example that I've discussed, and then the second is the specific one that you would need to fill in and develop to identify your professional development plan, which is required for the task to be completed. So I hope you would be logging into Moodle and obviously looking at completing some parts of this, so that at some stage, once you have completed some of these templates would then also be looking at meeting some of the criteria of the assignment tasks, which are set in the assignment. And we will discuss that next week, at 11, which will be the last session for this unit. And that would mean that once we've discussed the assignment, you'll have a few days and weeks over the Christmas break to be able to, complete the assessment and the assignment, for this particular unit. Now, at this stage, I would like to ask if there are any questions, if there are any doubts that you have for today's session. and would be happy to discuss or, provide more information. So any questions at this stage? So feel free to go into some of the material, which is now going to be up on Moodle shortly after the session, including these templates, which I've mentioned. And then once you have completed some of these templates, download them, and obviously, send them over on email so that they can be assessed further from a point of view of, meeting the requirements of the tasks and the assignment. So take care, enjoy the rest of your week, and I will see you next week to discuss the last bit in terms of this unit, which is the assignment discussion, so that we can bring this particular unit to a close. Thanks very much for joining. Thank you.